When someone comes to see you as a surgeon regarding problems with their lower eyelids, often people say, oh, I've got bagginess, or my lids feel puffy, or they look puffy, and I've also got dark circles. Dark circles are often mentioned. And there are some sort of new and emerging treatments which work really well for this. You've obviously got the traditional form of blepharoplasty to basically redrape the fat over the lower lid, and that works beautifully. For patients who are worried about the extent of and the invasiveness of blepharoplasty surgery, something that's been gaining momentum over the last few years is fat grafting, and so you can blend and conceal the junction between the lid and the cheek, which is caused by gravity and the mid-face dropping a little bit as we age, and also by weakening of some of the connective tissues. And you can blend that in. The other beauty of fat grafting is it addresses the dark circles. There are two different types of fat grafting you can use for this, but they both work beautifully. And as one of the great things is when now whenever I sort of see someone, I always think fat grafting would be up there as a choice for that particular problem because it works so well. You harvest fat from another area on the body, say the tummy. It's done via liposuction. Sadly for the patients, it's not large volume liposuction. It's usually just a small amount. You need maybe 20-25 mils. And this is then processed, so you've got living tissue, living cells, and then it's re-injected back into the tissue. And because it's re-injected back into the tissue, it's only you. There's nothing else to it. There's no foreign body. And so it reintegrates. Blood vessels grow into the fat, and then it's there, and it's permanent. You don't get any foreign body reaction, as I said. You don't get any allergies to it. It's your own fat. It sits there, the body grows into it, and it's permanent. Coupled with that there is some evidence to show that the stem cells that are within the fat transfer have a direct de-aging or regenerative effect on the tissue. The actual mechanism isn't fully understood yet, and we think it's something to do with growth factors within the lipoaspirate. That means the stuff you sucked out, so lots of good stuff, if you like, in the fluid. The fat cells themselves providing revolumization, and then the stem cells actually having a direct effect on the tissues. Whatever it is, you see a definite improvement in skin quality and skin tone, really. So it's a great mechanism for de-aging the area of the mid-face. You need to treat the mid-face, a little bit of the brow and the temple area. Otherwise, it just looks a bit isolated. So you sort of blend it in, but it can be used to address the nasolabial fold, so the junction between the cheek and the upper lid.